Did you wake up this morning with a pink or even a red eye? Today we will be going into the possible causes of pink eyes and what you could do at home and when you should see your eye doctor. Hi, I'm Dr. Michelle Lee, a board-certified ophthalmologist, and today let's talk all about pink eye. Please like and subscribe to my channel where I post a new video every Saturday about eye health and disease. There are several causes of pink eye, so I'm going to make this as organized as possible to address the most common causes that I see in the eye clinic. If you are not sure what you have, or if you have any serious or sudden symptoms like blurry vision, flashes and floaters, or severe eye pain, please see your eye doctor as soon as possible to rule out a vision-threatening condition. The first thing everyone thinks about when they have a pink eye is an infection. The classic pink eye that we all get once in a while is called viral conjunctivitis. This is usually due to a very contagious virus called adenovirus and is the most common cause of a pink eye or eyes. Symptoms vary, but most people complain of tearing, sensitivity to light, and irritation. The eyes typically look pink, hence the popular nickname for this condition of pink eye. More recently, another cause of pink eye that you should consider is coronavirus 19 or COVID-19. A pink eye can be a presentation of COVID-19, so coupled with any exposure risks or any other COVID-like symptoms, make sure you take care of yourself and get testing if indicated. If you think you have viral conjunctivitis of any kind, I recommend preservative-free artificial tears, frequent hand washing so you avoid infecting others around you, and cold compresses to the eyelids. I also like to recommend putting these tears in the fridge and using these cool tears to help alleviate some of your symptoms. Stay home from work or school for a week and use this time for self-care. This condition typically does not affect your vision, but if you do start to notice blurry vision, it is important that you see your eye doctor to rule out a more serious form of this infection that can result in permanent scarring of your cornea. Another common infection is bacterial conjunctivitis, which is usually just in one eye. The main difference between bacterial or viral conjunctivitis is that bacterial conjunctivitis usually just affects one eye and causes a lot of discharge or pus, whereas a viral conjunctivitis usually affects both eyes, and instead of pus, there's usually clear mucus or tearing. If you have bacterial conjunctivitis or you suspect you might have a bacterial infection, you must see your doctor to start a course of antibiotic eye drops or ointment. Another common cause of pink eyes are allergies, specifically allergic conjunctivitis. This is usually due to seasonal allergies and can occur in conjunction with a sinus headache, nasal congestion, sneezing, coughing, and other allergy symptoms. If you have seasonal allergies, start by treating your allergies. Take an over-the-counter antihistamine medication, and if you have eye irritation and itching, I would start off with some preservative-free tears. If the itching is pretty uncomfortable, I would recommend Pataday, an over-the-counter allergy drop that works as both an antihistamine drop as well as a mast cell stabilizer. You can also use a preservative-free antihistamine drop like preservative-free Alway if you know you are sensitive to preservatives. You can also get an allergy type reaction to the eyes if you have atopy, a genetic tendency to develop allergies that is associated with eczema, food allergies, asthma, and rhinitis. If you have atopic conjunctivitis, or if you think you might have this, it is best to see your eye doctor since you probably will need medicated treatment like steroid eye drops or other prescription eye medications to alleviate your symptoms. Are your eyes pink and irritated? Does it feel like something is in the eye? You might have dry eye, a very common cause of intermittent pink or red eyes. I'll link my videos on dry eye and dry eye treatments down below, but definitely start out with some lifestyle changes and maybe some preservative-free tears. If you have constantly blurry vision, severe eye pain, or you cannot get relief with over-the-counter treatments and lifestyle changes, it sounds like it might be time to see your eye doctor. Did you wake up with a red, bloody-looking eye? You might have a subconjunctival hemorrhage, which is when one of the fragile blood vessels in your eye breaks and causes a bleed in the conjunctiva, or the white part of the eye. Even though you probably didn't feel anything, this can look very dramatic. And this can happen to anyone, but most of the time this is caused by violent coughing, retching, rubbing, or sneezing. If you want this to go away as quickly as possible, I would recommend some preservative-free artificial tears, but if this is recurrent or you have eye pain or blurry vision, definitely see your eye doctor to make sure there's no other underlying cause of your bleed. And most importantly, there are some serious causes of a pink or red eye, such as angle closure glaucoma, which can present as a headache around the eye, blurry vision, and halos, as well as some serious infections and inflammatory conditions. If you have severe pain, headaches, sudden loss or blurriness to your vision, flashes and floaters, or any sudden new symptoms, see your eye care provider immediately. If you cannot access your eye doctor, go to your nearest emergency room. You just might have an eye condition or problem that needs immediate treatment. I'd love to hear what kind of videos or eye conditions you want to know more about, so let me know your thoughts in the comments below. Thanks for watching, be sure to like and subscribe, and I'll see you at my next video. Bye!